What does being a doctor mean to me? I think being a doctor is a very sacred thing. It allows you to participate in people's lives at the times when they're the most vulnerable. I think in medicine, we think that everything is right or wrong, black and white, when everything is really a shade of gray. The art of medicine is trying to apply relevant science to your patient, but also taking into account their specific situation and their values and goals. And I don't think we do that well in traditional medicine. You guys, Sydney, can you not touch it, please? Nikki, are you gonna finish your cookies? Zachary, put that down, please. Oh dear. On a normal day in my house, it's very busy.
Yep, thanks.
Everybody needs to leave for school early.
Okay, Zachary, you want pasta sauce on yours?
And some days it's me running to merge.
Sydney, I'm gonna make yours now, okay?
Being a parent on my own, it can be crazy at times, but it works. I always wanted to be a mom. I had wanted 3 kids, but we had negotiated for 2 as long as it didn't lead to 3, and then we ended up with twins.
I wanted a little sister, but then 2 little brothers.
My pregnancy with the boys was a roller coaster. At 20 weeks, we had a fetal assessment. She came back and she said, there's a huge problem. Nicholas was almost gone, and we needed to go in the next day for surgery. I'd never really thought about twin-twin transfusion syndrome.
I got too much blood, and Nikki got too less blood.
When we had them at just over 30 weeks, Nicholas was just over 2 pounds and Zachary was just over 3 pounds.
They're so small, so tiny. The first time I saw them, we went into this room with this huge machine. They were so tiny and the machine was so big.
At 40 weeks, we found out that Nicholas's brain developed abnormally. He had diffuse changes, lots of extra folds in his brain. The neurons didn't migrate to the cortex. They just said he would probably not have much more than reflexes.
I do!
Raising a child with cerebral palsy is scary. You have no clue what their capabilities are going to be.
Hi, Nicholas. Are you doing your stretches? Hi.
Nicholas was very spastic. They used to call him a ninja because he wouldn't really bend his arms and his legs.
We started to notice he wasn't keeping up to the same as Zachary.
One of 2 is crawling. This is one determined guy. He's discovered he can hold the bottle. Come on, Zachary.
Zachary started pulling ahead in his milestones.
Show mommy how you walk.
And Nicholas was still working on earlier ones. There's always a plan for his motor skills. OT-PT home program, speech and language, medications. We were always at the hospital. This was kind of a cute thing. Every time he went to hospital, they would... This one's from Zach. I love Nicholas no matter what. Get better soon. I hope you still like cars and Spider-Man. I love you. Are you happy? Zach. Nicholas's EEGs showed increased risk of having seizures. She didn't recommend treating him. That all changed.
Zachary! Nicholas!
At 18 months, we really started to notice some issues that slowly progressed. He would often wake up at night at certain times and just have stridorous vomiting episodes. His whole face fasciculating. He'd make gagging noises, tongue thrusting, screeching, vomiting blood. And we would literally have to listen for him. And as soon as he started, we had to run over, flip him over. Otherwise, he would aspirate. I called neurology and I said, something's wrong. It's the same times every night. Could these be related to nighttime seizures? And they finally just said, okay, we're gonna do a home EEG. They called us back and said, every time Nicholas goes to bed, he's in status, meaning he's seizing the whole night when he's sleeping. They ended up starting 2 medications right away, which did cut down the episodes for a while. Things started really escalating just after he was 3, and things just started getting out of control.
Nikki looks like he's having a seizure. You okay?
It's scary because you feel like he's gonna have a seizure any minute.
I woke up one morning and realized he was seizing and he was having difficulty breathing.
I heard sirens come onto our street. I go downstairs. My mom is on the couch with my brother, and my brother is barely moving.
He was staring off into space. He wasn't really present at all.
He didn't even seem to realize that anyone was there.
He was pale and going in and out of seizures. We went right to children's, ended up in resus, and he ended up in ICU on BiPAP.
He has seizures. Sometimes he has to go to the hospital.
Nikki's been in the hospital so many times.
He's got new seizures in the focal part of his parietal lobe. So we are trying to find more of them and treat them. Maybe we'll come home today or tomorrow. Just waiting for the plan. Push a button. Push a button. Nikki likes to push a button.
I remember going to the hospital and just seeing him so weak. It was very difficult to watch because there wasn't really anything we could do besides wait on the doctors.
When I'm at school, I'm worrying about him. Pretty much everywhere I am and he's not, I'm worrying about him.
I feel worried that he's gonna go to the hospital and he's not gonna make it. I'm worried that he's not gonna make it.
His neurologist basically said there is a risk of sudden unexpected death in epilepsy. He might not wake up. She looked at me and she said, do you want him resuscitated? When we started talking about the fact that he could die from seizures, it all of a sudden became very real. They started to realize this was serious. He may not make it the next summer. Nicholas had been on quite a few medications. He started on the clobazam, valproic acid, and then they added the Keppra when his seizures got bad. I felt like we were giving lorazepam like candy, but it wasn't doing anything. We'd go in, we'd get loaded with whatever they felt they should load him with that day, and hopefully it's going to be a bit better.
Nicholas.
He just became really not present. He was a zombie. The unfortunate thing about all these seizure medications is that they just take away the personality and they create these blank faces. And so we really lost him. We were at the end. There was nothing else except just throwing things at it to see if it would buy us some time. At the end, he was having 3-4 seizures an hour. And then he started regressing, stopped being able to walk as well. It was really hard to watch because there's nothing I could do. Even as a physician, I couldn't do anything for my own son. It was survival mode. So when he finally came home and basically we had the discussion of whether we were going to resuscitate him, I came home and I cried and I went in and I quit my job because I figured I need to be a mom. I'm not gonna have my own child die and not spend time with him. We just stayed home and tried to just be as quiet and comfortable as possible. You have to know before you bury your child that you've tried everything. I started looking online, like any mom would, just trying to find out what to do. And I'd heard a little bit about cannabis and epilepsy and thought, you know what, why not? I don't want to keep adding all these medications. We've had 3. When we're at 3, I want to try something else. That was the next step for us. The next question was just how do we do it? Our family's been coming out here for about 8 years. We got the keys the day I found out I was having twins. Since then, we've been out every summer. I love the fact that they just can come out here and just get away from everything and just be kids. I had been thinking about trying CBD, and I'd asked my neurologist about trying it. She said, you know, it might be a great option, but I can't help you. Let me know if that's something that you decide to do. It was just a friend giving me a bottle that they weren't using. For me, it was a last resort. I actually didn't think it was gonna work. I thought, well, I might as well try it. And that night, I gave him 1 drop.
Really small one?
Then I put him to bed.
Because this other one is
He slept the whole night.
pretty small.
He never woke up once.
Has 97.
Monday morning, he was a different person. He had spark in his eyes. He was present, and I remember feeling like he was there, and he was excited, and he was happy, and he was starting to play again. It was very obvious that there was something happening. He wasn't spending his energy all night seizing. He was actually sleeping, and he had more energy in the day. Within 2-3 weeks, he started becoming stronger. We have about 60 stairs up to the cottage. I've always had to carry him on my back every year. This year, no problem. He goes up and down the stairs. And I'm the one sitting back, trying not to help him too much. He is being very clear that he wants to do everything. He had gone from 4 or 5 seizures an hour and a kid that was like a zombie to a kid who was playing and energetic. The seizures weren't a huge part of life anymore. They were starting to be controlled. At that point, I just decided we were gonna live. Now, we're able to do more with Nicholas, and he is so happy.
To get out on the tube and Jen to be there with him, she lets him have all these experiences.
Just his smiles. Like, you know he's having fun. His smiles mean everything. I'm just so happy to see him be able to enjoy life.
There's so much more promise of things that we can do together, not being too held back by his help. Because he's a go-getter himself. He wants to try everything. He's got a drive in him that he didn't have before.
We focus on being together, and we focus on enjoying life.
Nicholas has decided that he is a skier.
Last winter, I was actually able to take him skiing. I put those skis on him, and he looked at me like, "You're gonna let me do this?" Nicholas was in heaven. He was so excited. That, for me, was that big moment when I was like, wow, we did this. Nicholas was never supposed to be able to do this. Since then, it's just progressively gotten better and better. That intellectual ability has just skyrocketed. With school, he now uses a communication device. He participates in class. He'll hold up his iPad and type what he wants, and his whole class is all looking at him, and they are interacting, and they're so interested in what he has to say. He's just like any other 7-year-old.
3 years ago, I was on the couch with Nicholas. Do you want to go in there now? Just need to stay inside and stay
unstimulated, because any type of stimulation would set off his seizures. Just hold him around the waist. Nicholas has gone from being the baby to being the brother. Now I see them start to play together, and I see Zachary trying to teach Nicholas things and try to help him do things.
I just figured out today he loves me giving him underdogs.
Oh, he went under you again.
He's always happy. He's not afraid of anything.
Okay, that's as high as you can go.
He's capable of lots.
Hey, Vicky fly, Vicky fly.
It feels like a miracle, seeing him walk and run around. Sometimes in my head I go, those doctors were wrong.
I'm just so happy that we've had this success with the CBD, and I don't have to anticipate for every next crash.
This way, Baker's sleeping. Okay. I love them. Like, I know I wanted a little sister, but I think having 2 little brothers is definitely better. Like, obviously, like, having a little sister would be awesome, but so is having brothers.
The medications that we still give Nicholas are Keppra and clobazam. The clobazam will probably stay on him, but the Keppra, we might start weaning down now. We took off the valproic acid, and then this will probably be the next one we take off. It's a newer seizure medication. It works pretty well. It never controlled his seizures. After I saw that it was working, I called neurology because they did say, you know, if you're going to try this, we need to know. They didn't seem to be interested in the fact that he wasn't seizing. They were more interested in, you know, who was providing it for me. Thank you. So then she said, well, you have to stop it till you get a prescription. And I said, he could die. I said, if I stop this, he could die. And she said, yeah. And at that point, something happened in me. I got so angry. I couldn't believe it that I had a child that was palliative, that we were talking about resuscitating. And within a week, he was a different kid. He wasn't seizing. And because I didn't have a prescription, I would have to stop it. It was so focused on the political aspect of cannabis. It wasn't focused on the patient. I worked all my contacts. Everyone just said, Jen, I know this is working, but I can't help you. If I wasn't a physician, I probably wouldn't have been able to figure it out. Because at the end of the day, it was a colleague that saw how well he was doing and said, look, Jen, I'll just help you. That was a moment when I realized that there's something wrong with our system. That really made me think about what I do as a physician for other families. Having been in that situation, I really felt like these families deserved a chance.
I think there needs to be a huge shift. Because right now, I don't think that the medical system is looking out for patients 100%. With Levi, I would say we kind of knew right from little, like, that something was different. He wasn't hitting the milestones on time. He walked very late. He talked very late. Everything was in a row. It was color coordinated. Everything had to be in the right place, always.
And if he moved it, he got mad.
He got frustrated so fast, so easily.
I don't deserve any friends.
It would go into meltdowns where he would scratch his face, scratch his arms, his chest. He'd punch things, punch people. He couldn't express his feelings. And I can only imagine in his mind feeling like, I know how I feel, I can't tell you, but you assume that I don't know feelings. Because for the longest time, we thought he just didn't know what angry was, what frustrated was. It was at that point that they kind of linked the ADHD, the sensory processing, the extreme anxiety. They kind of linked it all together and said, you know, Instead of it being all these different things, it's autism. The first thing that any of his doctors wanted was medication. They wanted to medicate the behaviors.
We tried so many different drugs, one after another. Oh, that doesn't work. Okay, try another. Here, try this. Here, try this.
Citalopram, Concerta, Intuniv, Risperidone. For us, it was one bad experience after another. It got to the point where Levi would go into a meltdown just knowing that it was time for his meds. It just didn't sit right with me, that this is what I'm putting into my kid.
I have at least one Pokemon from every region. Golden, Chinchu, Sinistea.
The first time that I brought CBD up to Levi's pediatrician, she shot it down immediately. Her reasoning was they don't know the side effects of it. And I just simply asked her, well, you know the side effects of these other medications and they're horrible, but that makes it okay because you know about them. And then we tried a few other medications, and at his next appointment, he had a meltdown in her office because she had suggested another medication. And I just remember sitting there bawling because I felt so helpless. And she finally said she was willing to refer me to Dr. Anderson. The first time using it, you could almost see the calming in his body.
I'm clever like that.
You are clever like that. I had asked him, I said, how does it make you feel? He said, I can slow down. I was like, that was amazing to know that he felt it. He felt the benefits of it. And now he is able to slow his thought process down and work through problems.
I noticed he could express his feelings, because before he never knew that.
After he had started using CBD was the first time that he ever said, I am angry. He said, Mom, I am angry. For him to be able to make that breakthrough gave him a freedom that he hadn't had before. We have been over a year self-harm free, and I never ever thought that we would get there. He doesn't hit himself anymore. He doesn't scratch himself.
I have a twin for that. She's just gonna get it.
The difference in him pre-CUD to now is night and day. Yeah. I know he was happy then, but he is truly happy now. To have someone like Dr. Anderson in our corner is priceless. She told us a little bit about her son and some of the struggles that she went through. And with that, it made me hopeful that we're able to get onto a path where we're able to just be happy again, to feel heard, to feel understood. That's rare.
Were they all hiding? Are they all hiding in there? Are they having a sleepover? Wake them up. Having a child that's medically fragile has made me a better physician in many ways. They're lazy. These families understood that I truly cared about their situation, and I truly understood, having been there myself. That's an invaluable thing to have with another family.
My good friend tagged my name in a post, and it was Dr. Anderson. Anyone needing help with this, please contact me, reach out. She was going through what we're going through, maybe in slightly different ways, but still same probably obstacles, same
struggle.
So,
you know, different story, but same struggle.
She started making like these gaggy facial movements, and then it just kept happening, and it seemingly progressed into more of jerking of the arms, more of pursed lips. I called our family doctor and they said, well, just go straight to Children's. Within 2 hours, they had come and said, you know, we're gonna send a neurologist. Have you ever heard of infantile spasms? It's a really rare form of epilepsy, and it's pretty hard on the baby's development.
Being that first-time parent and then seeing all this kind of playing out, that was, you know, heartbreaking.
They wanted to start her on steroids, like right away, before we left the hospital. She had massive weight gain. Within a month, she blew up like 20 pounds. She didn't respond to the steroids. Then we tried another drug called vigabatrin. That one also failed. Reading the pamphlets for these drugs, you just kind of go, oh my goodness, like.
Lots of
behavioral issues.
Yeah, not being able to sleep.
You read them and then you get to witness them all, one by one.
Once the doctors start running out of options, you can tell, and they don't really have many answers for you.
No, just more pharmaceuticals. She was just having too many seizures to actually gain any control. Unfortunately, it was the surgery that had to be done. Her first surgery, she had a functional hemispherectomy, which is a disconnect and a removal of a portion of the brain. She was seizure-free for 1 year, and then her seizures came back. So then she needed to have an anatomical hemispherectomy, which is the full removal of the brain from the affected side. It is the most invasive brain surgery someone can have. You can do it. She basically lost the ability to move the left side of her body. I took a lot away from her, but it also gave her a lot too. Right now, we're still sitting seizure-free, but because of her unknown diagnosis, it's still a possibility.
Anything can happen.
Is that her little brother? Do you have a little brother, Emma?
Mm-hmm.
Where's your brother?
We really started diving deeper into what can we do, and we need to be more of Emma's advocate in terms of where are we going to go next.
I did know that cannabis was working, and specifically CBD oil was working for a lot of children with epilepsy.
So that was when we kind of started looking into it, I think, a little bit more, and, you know, talking to the doctors about it for sure.
Yeah, or trying to.
Trying.
You need a referring physician. So every single appointment I went to, I brought it up every time I could, and I would hand over the forms. But I was always met with, there's not enough studies, she's too young. I would constantly say, well, all this is okay to try with her, but we can't try this plant. Why not? Why not Emma? The pediatrician, eventually, she said, okay, Sarah, I'll sign it for you. She started taking cannabis oil, like within, I think, 3 days. It was huge to see. It was so nice. She was just a little bit brighter and like just trying to do more things.
Just her whole demeanor in general just went up, like in a positive way.
Her development progressed. It's helping with her spasticity now after her surgery. Having something that, you know, was helping even in a different way from seizure relief was like, oh, wow, this is amazing. Like, at least she's progressing. At least she's not going backwards. At least she is walking, and this is helping.
It just shows what you can do if you be really persistent. It's a fight, it's a battle, and that's what you gotta do, because Emma can't voice it for herself.
Oh, yeah, good job.
Hope's not lost. You just gotta find it, the right person, which has luckily enough happened to us.
It is frustrating as a mom and a doctor, the logistics that you have to go through to get CBD for your child. Like, as a physician, what are you willing to do for your patients? Having such success with something that's completely controversial, and then having nobody that will help you with it, but seeing your child turn around within a couple days just questions really the ethics of what we do. When you have something like CBD, which is not psychoactive, but it's got such a stigma to it, people refuse to even understand it. And a lot of people just don't want to come near it. But I think every parent deserves to be able to say at the end of the day that they tried everything.
For us growing up, there was a stigma with cannabis. So it was difficult to decide to try.
It's not something we want to hide, but it's hard to know how people are going to react. It helped our son, and it just needs to be known. If it could help somebody else, why not try it? Vincent was diagnosed just before I was pregnant for our second child, Adele.
They diagnosed it as a severe autism. It was mostly based on the fact that he was nonverbal at the time.
So we already knew Vincent had autism. The signs were there. We knew it. But then when you
hear the diagnosis, then it still takes a lot of emotions.
It's like a punch in the gut, slap in the face. Like, you knew we were going in there. We knew what the outcome would be, but
to hear it was still very difficult.
He started by pulling out his hair when he was upset, and he actually would bleed from the hair coming out and was like bald for a very long time. And then it went to scratching behind his ears, hitting his head.
It was very difficult to watch your child hurt himself and not be able to comfort them and stop them.
When you have a child with autism, you just have an open mind about everything. We've never had a point where we contemplating putting him on any kind of prescription drug. But if we can help him in certain ways, we want to. You're doing research, you're trying to find something that could help. We have a lady in town who has MS and uses cannabis to help with that. She got me to join a few groups on kids with autism and parents using CBD, just learning, listening to their stories. Once we actually decided this is the route we're gonna take, I couldn't find a doctor that would help us, which was frustrating because there's something there that I felt very strongly that could help him. And then this lady who showed me through it, she mentioned about Dr. Anderson, who has done the research as well, that's lived through it, that has seen the benefits. It was like a security blanket almost. Yeah, it was really no fear. It was just, let's do this. Since we started CBD, we can see a pretty clear change.
The first thing I noticed, he wasn't getting as frustrated, he wasn't hurting himself as much.
Not as agitated, less muscle tension. He'll just be able to relax. And it's not that he's stuck in a bed or on the couch and doesn't want to move. He wants to do things. We play at the park with his sisters, and he watches them play and observes. More vocal, better concentration, I find. Whatever's gonna agitate him, it kind of just kind of gives his brain the message like, that's okay, we can deal with it, and then he actually has fun. Vincent's the best kid in the world.
And his giggle is
Contagious.
contagious, yeah.
Very contagious. You can hear him laughing, and then it just puts a smile on your face, and you're laughing too because he's just got the best laugh.
He's very affectionate. He'll give hugs, and he likes to get squeezed.
Our thought is kind of, you're missing out if you don't know him.
We're not looking for a cure. We're looking simply how we can help our child just have a better life, an easier life. If that means trying something that is different or has a stigma, so what we like to do is try to help and get a better life for him.
Watching my son the last 5 years after trying cannabis, it's amazing to watch how much he's developed and grown. We are now 3 years without any hospital visits for seizures. When I think about my role in these families' lives, I think about what would I have wanted in this situation. As a physician, we're taught to be very private, and it's not okay to share your personal life with your patients. Hello, how are you doing?
We're good. You?
I'm doing good. How's Emma doing? When I started working with these families, though, I felt like that was a very important part of the journey. The school's been good with using CBD in school. When you can connect with someone on that level, I think that that's therapeutic in itself. Medical cannabis. So I've taken that and really tried to share my story as a way to help people understand why it's important. I now have a consult-based practice where I help other physicians manage kids as well as adults on cannabis and try to educate. I've had the opportunity to talk to multiple groups and share my story, but also share how I work with these kids and the methods that I've tried to use to marry traditional medicine with the use of cannabinoids in kids. I've done everything from deliver babies to hold people's hands as they die, and I've worked in emergency, in hospital, in family practice. And I think that this has been the most fulfilling thing that I've done with my career. And I didn't want these families to not have the opportunity that I had. I think it's important for physicians to look at the kids that are actually being helped tremendously by CBD.
Quite painful.
We're so trained to look at things from one perspective in medicine. When you're looking at patients who have no other option and saying, no, I'm not gonna touch CBD, I'm not gonna go there, go somewhere else, you're fine to do it, but go find someone else, There's something terribly wrong with that.
I think it's important to hopefully get people to not have any stigma around cannabis as being used as medicine, someone's medicine.
Don't be afraid. It's scary because it's not something really talked about very much. It really can help, and it's just we need to listen to other people say it's okay that you want to try this. People can help you.
Don't give up.
Yeah.
It's a hard fight sometimes, but don't give up. It is worth it. It's worth every doctor's visit, every fight that I've had to fight, every minute of research that I've had to put into it. It's worth it.
For a physician, why do we do what we do? How do you make a choice to try something and to let your patient try something or not let them try something? Where do we get that blueprint for how we make that decision? No is not an answer for CBD. Education is, and I think that it's really important for people to understand the patient that they're treating. How far do you go to try and save your child? And how far do you go to help another family when it comes to CBD?
He says, more, please.
Okay. do. Sometimes it's hard to hold, but you can't bear it. Doesn't have to be so. Changes can be made. You can move a mountain if you use a larger spade. Anything can happen if it's a marvel.
Good job.
The end.